Hello, again, this is Jay Vaughn with the law firm Hendy, Johnson, Vaughn, and Emery. We have offices in Louisville, Kentucky, and Fort Mitchell, Kentucky, right near Cincinnati, Ohio. I'm a plaintiff's trial attorney handling mainly truck crash cases and traumatic brain injury. And there's the second video of a series of 3 that I'm doing on traumatic brain injury. The first video, if you haven't watched it, please go back and do so. Cover some of the basics of traumatic brain injury and what an accepted definition of mild traumatic brain injury is. Today's video is really going to focus on the common signs and symptoms of traumatic brain injury. There's a lot of them in different categories. I think it's important to know about them. So when you're meeting with potential clients, you're talking to them on the phone or meeting with them in person or doing an intake by Zoom, you can go through these symptoms, ask your clients questions, ask their spouse or their parent or someone close to them some of these questions to see if they have these symptoms, because many times traumatic brain injury doesn't get diagnosed properly. It takes a while, it gets missed, it doesn't get appreciated by certain providers. Some medical providers are focused on, if you're seeing orthopedic, they're focused on the neck or the back, the spine. They're not focused on the head. It's important for you as their attorney to be aware of these signs and symptoms, because ultimately we want our clients to be treated by the people that can help them the most. So the main categories of traumatic brain injury symptoms really are physical, thinking and remembering, social or emotional, and sleep. Those are really the 4 categories. The physical symptoms can be bothered by light or noise. If you have clients that tell you, well, light really triggers things, gives them headaches, noise makes them disoriented or distracted, that can be a sign of brain injury. Dizziness or balance problems, feeling tired, no energy, headaches, nausea or vomiting. That usually happens early on after the incident, after they hit their head or their head gets struck by something. Vision problems, ringing in the ears, changes in hearing, taste or smell, numbness or tingling, clumsiness. Those are the primary symptoms or signs in the physical realm. So physical signs and symptoms of a traumatic brain injury to be aware of. Then we move to what clients experience a lot, or especially when they finally open up to you, we'll tell you about the category of thinking and remembering. They have attention problems, concentration problems. They feel slowed down. They're foggy or they're groggy. They have problems with either short-term or long-term memory. They have difficulty thinking clearly. They can't follow directions like they used to, or maybe simple tasks, it's taking them longer to do. And it may take your clients a while to realize this, that they're having these deficits. A lot of times it's when they return to a normal environment, when they go back to work, when they go back to school, and they start to go through normal, easy activities, yet now they can't do them the same. They can't do them at all. They do them wrong, and they finally realize that something's not right. Then there can be social or emotional signs or symptoms: anxiety, nervousness, irritability, easily angered. They're more emotional, either crying or sad. They have mood swings. They appear depressed. They have flashbacks of maybe the incident, or they're seclusive, withdrawn. They don't want to be around their loved ones. They come home, they want to stay in the basement. They don't want to talk to people. And that's not their normal personality. These are some signs and symptoms of social or emotional problems or due to brain injury. And finally, sleep. They're sleeping less than usual. They're sleeping more than usual. They have difficulty falling asleep, and they're having nightmares. And a lot of the problems and deficits individuals have with brain injury stem from problems with sleep. So it's really important to be aware of that. So those are the main signs and symptoms of traumatic brain injury: physical signs and symptoms, thinking and remembering signs and symptoms, social or emotional signs and symptoms, and sleep signs and symptoms. So with that, hopefully that gives you some information for your clients in cases you have. We'll cover another video talking about some of the main medical specialties for traumatic brain injury. Thank you again. I'm Jay Vaughn with the law firm Hendy, Johnson, Vaughn, Emery.